Good afternoon. My name is Jeremy Davis. I'm the acute care nurse practitioner out of Shreveport, Louisiana. I practice hepatology, a gastrointestinal specialist. Tonight's discussion for the podcast, PCP screening for MASLD and MASH, identifying at-risk patients. So the questions that come up are, well, which patient population should APP routinely screen for with MASLD and MASH in a primary care setting? And this could be based on risk factors and current guidelines. Well, what we understand are patients that may not have abnormal liver enzymes can still be at risk for fatty liver disease, MASLD, MASH. Patients that may be pre-diabetic, type 2 diabetic, if they're overweight, obese. What about cardiovascular disease, hypertension, hyperlipidemia? These patients are at risk for MASLD and MASH. And so awareness is very important as far as screening is concerned. Well, how do we go about screening these patients without the use of, the fancy tools that the gastroenterology guys and the hepatologists, those fancy tools that's being alluded to or non-invasive testing, measuring transient elastography, such as FibroScan, or maybe an MRI study. But you don't have to have those in order to see if someone is at risk for MASLD and MASH. You take the comorbidities, and then you can do something as simple as a FIB-4 fibrosis score test. This is a test that uses common lab, CBC and CFB, combined with age, and it's a formula that you can derive to see if someone is at risk or not. And so there are calculators that you can look at online in order to calculate this risk. As far as other scenarios, the thing you want to think about is age. There may be a little bit limitation as far as the accuracy of that test. But the main thing to remember is if there's a FIB-4 fibrosis score is greater than 2, then the patient that you're seeing is likely going to be at risk for MASLD or MASH. And so therefore, the opportunity of considering referral to gastroenterology or hepatology for further evaluation and management is recommended. How do we communicate a positive screening result indicating the risk of advanced fibrosis to a patient? And what would be the next steps in management or referral process? So I'm going to answer this to the side from a gastroenterology and hepatology standpoint. So if a patient is referred to our facility for further evaluation of MASLD or MASH, the first thing that we're going to do is we're going to do further lab studies as well as further non-invasive testing and possibly liver imaging to see exactly what's going on with the patient. So, for example, with MASLD and MASH, we understand that the presence of steatosis on an ultrasound may provide a possibility of fatty liver, MASLD or MASH, but also what we understand is that there are other things that can lead to that scenario as well. So doing further lab testing or further liver serologies to rule out any other cause for liver disease is very wise and important. As far as imaging, ultrasonography is typically the first base imaging obtained in order to look at the liver closely and look at the surrounding anatomy, and then further non-invasive testing. So the patient was referred with a FIB-4 fibrosis score. We would then go to other non-invasive testing with a test called an enhanced liver fibrosis test, and you compare it with a vibration controlled transient elastography. Also, with our facility, we use a machine called a FibroScan machine in order to elicit a big picture idea of what's going on with the patient. If we find things that are significant with serologies or things that may warrant further testing with invasive testing, then that's exactly what we do with consideration of a liver biopsy. But for the most part, non-invasive testing helps us derive an understanding of what the patient may need. As far as fatty liver management, that's going to be the main thing that we typically find. And so diet, exercise, and weight loss are still the framework for success with patients with fatty liver, MASLD, or MASH. When we think about diet, we definitely entertain a Mediterranean diet. And the main thing that I tell patients is this is a cohort of food choices that you can incorporate into your meal planning. It does not mean that you have to follow a specific diet, but incorporation of meal planning into what you already do will be very instrumental and very helpful. Providing that information in the clinic is something that we also do. As far as physical activity, we understand that physical activity is very paramount in success with energy expulsion. So if someone is becoming more physically active than what they were, then the opportunity is that with increase in physical activity, you're basically utilizing stored energy, which we also know is subcutaneous tissue, which in turn can help promote what the next step is weight loss. Now, with weight loss, sometimes it's easier said than done, but there's an opportunity that exists that if you incorporate these three principles, that you can easily help control the amount of fibrosis and the amount of fat in your liver without need of pharmacokinetics. Now, if someone does have comorbidities, then the opportunity of pharmacokinetics, such as injectables, such as GLP-1, may help with a lot of different things to include fatty liver and their other comorbidities. With fatty liver, there's also, depending on the amount of fibrosis the patient may have, if their fibrosis score is a 2 or a 3, then the opportunity of medications such as Resmetirom or Resmetirom is the first and only drug approved by the FDA that can help reduce fat content in the liver and can actually been proven to show halting or regression of fibrosis in a patient who has MASH. Lastly, what are some challenges and strategies for implementing MASLD and MASH screening within a busy primary care practice workflow? The answer is simple. Look at the patient's chart. If they have comorbidities such as hypertension, hyperlipidemia, diabetes, cardiovascular disease, and even if they're overweight, those are simple risk factors that can contribute to the risk of MASLD and MASH. Also, again, think about the FIB-4 fibrosis score. That is something that you can do simply in addition to looking at the chart to calculate a score. If the score is greater than 2, then consider referral to gastroenterology or hepatology in order to further assess and manage the patient collaboratively with you. Again, my name is Jeremy Davis. It's been a pleasure visiting with you this evening. If you have any questions, feel free to reach out, and I look forward to speaking with you again. Have a great evening.